Hi, this is Dr. Richa Mittal with Radiant Health Weight Loss and Wellness. And today I have for you today to listen to one of my dear patients, Matt, who has generously offered to share his perspective about his 100 plus weight loss journey. And really, what we'd like to talk to you guys about today is mindset and how to move from inaction to action. And what are the common barriers or hurdles that people face when trying to start their weight loss journey. And Matt today is going to share with you a little bit of his perspective on those topics. And as you can see, we're in our homes doing our duty for social distancing. So thank you, Matt, for being here today. And I'll let you first start out with why you're sharing your story with us today.
Well, thank you, and thank you for asking me to do this and having me here, Dr. Mitchell. The primary reason, is anything to help you and get the word out of the amazing work you're doing. And if I can just reach one person who was maybe in the same mindset that I was back in January of 2017, then that's a huge win for both of us. And love to just continue to inspire people and just let them know that it is possible if you've got the right mindset and the right tools, which is, I had the mindset and you gave me the tools. So here we are, 2+ years later, and it's 110 pounds and well, who's counting? I guess you and I are. So no, very happy to be here. So thank you.
Thank you. Thank you for being here. So tell us a little bit about what some of the hurdles or mindset obstacles that you faced when you were first starting to make changes.
Well, I think the mindset, it's a stair step. At least it was for me, and I would imagine it's a stair step for most people because you don't get to 100 pounds overweight or even 50 or any sort of significant overweight number without having probably been through a couple steps along the way in mindset. So that the mindset just gets a little bit more serious and a little bit more scary each time because the stakes get higher as the weight increases and the age increases and everything kind of goes in the wrong, scary direction. So the mindset, whether it's at that first 25, wait, something's going on, I should take action here, to 100 pounds, like, holy crap, this is terrifying, I need to do something. But there's months and sometimes years in between those stair steps when you just don't take action. So this is really, my message is twofold. One is to acknowledge when those signals happen and the stars line up or whatever it is, that whether it's a number on the scale or whether it's a number on a medical chart or whether it's a change in the tone in your doctor's voice when they're talking to you, and whatever that is, or everybody has their own very personal reasons why, what's going to flip that switch. But the key is to recognize that. And the biggest difference that I found is that in working with you is that I now had a tool to be able to do something at that mindset. I've had that in other times. I mean, 10+ years ago, I had a scare with numbers and all those things, and jumped into a 16-week boot camp, physical fitness boot camp, an hour and a half in the morning, an hour and a half at night, and it worked great. But then, the worry was what happened on week 17. And I didn't have that support, and I didn't have certainly the medical support. So for me, it's recognizing when that is for you, and to then determine what is your plan and treat it as importantly as it deserves to be treated.
That's great. What do you think one of the major turning points for you were? Because we've talked about this before, and many doctors in their practices might bring it up with patients, and a lot of times there's this hesitation from healthcare providers too, and how to broach the subject. But did you have people along the way or medical professionals that helped to guide you or brought it up as a topic of something that needed to be discussed? I'm just curious.
Well, yeah, I mean, yes and no, I guess, and I don't know that anything. Obviously, nothing ever really made a big enough difference to get me to where I was in January 2017. Because when you have a physical or any sort of medical appointment, if the numbers say, okay, you're overweight, you're obese, whatever the term is, the doctor will just tell you that, and you kind of already know that. You don't need the doctor to tell you that. And the best is they give you a pamphlet or a website, and that's it. You're kind of on your own. It'd be like but however, we take our car in, and they'll say, yeah, your car needs a new transmission. They don't leave it at that. They work with you and fix it, right? So the difference when I talk to you about it is, we kind of, I kind of knew where I was, you acknowledged it and understood it, and then we had a plan. That's the difference in most doctors. It's just, the system is not set up for most doctors, or any doctors I've ever been to say this is serious, and I need a monthly, ongoing relationship with you to on just this issue medically, not just as a coach and a or a trainer, or anything that's just one part of the puzzle. So that's the biggest difference for me, and that's what never happened before. It was up to me to sort of trying to piece these things together, and clearly I didn't have those tools beforehand, which is what got me in that problem in the first place. So to think that now I'm going to be able to do it on my own, it just what didn't work for me. And I think that's the case with just about everybody. You meet people all the time that, that have lost weight, and it comes back because they don't have a real plan, and they take more care of their car or their bicycle or other things with regular maintenance and a regular relationship with whoever takes care of that. But with themselves, better do that physical, and they're in, they're out. It's something just to sort of check off the box, but it should be an ongoing conversation on the most
Right.
important subject there is.
Do you think there was something in your mind that switched where you felt like, now I do want to make myself a priority? Do you think that that's something that kind of happened, as
Yeah,
far as how you looked at things?
yeah, it definitely, the analogy I use is like one of those safes that has the three different, codes for it, where, I was about to turn 50, my kids were a certain age, had other milestones, and as
Yeah.
all those things came into perspective, that was the mindset that got me, okay, I've got to do something. Um, and it was bittersweet, because the good part was, okay, I'm there, but then enters the terrifying part, because I had been there, or some level of that, in previous times in my life, maybe 3 or 4 times in the last 20 years, for at different degrees of, kind of, oh crap, I got to do something. So for me, it's that. And I think for anybody, you get to that point because you every day, okay, I need to lose some weight, right? Whether it's a little bit or a lot, it's in the back of your mind at every time you're out, or you're deciding whether you're not going to exercise, or you're going to eat, or whatever decision you're making. Somehow in there, you're aware of this is an issue. But it's easy to not really address it when you don't really know the full plan. So you just sort of
Right.
go on.
And it sounds like, it's a part of your daily life. It's part of kind of just who you are every day. And especially if there's that constant invasive thought about, okay, I really need to do something, but I'm not. You almost want to just turn that off and not have to face it or not think about it. Um,
That's exactly what happens, is because you don't, it's, you're turning it off, but it's sort of turning itself off, because in the absence of a real plan, there's nothing to turn on or to activate.
yeah.
So, that you might see in the grocery store, oh, the low calorie this or that, oh, that means I can eat that ice cream, but it's not part of a full plan. And whether it's medication that I didn't know I needed to take, or a certain vitamin that I didn't need to take, or a certain level of exercise, all the things that you've helped me, for me, I had no clue. I was just sort of throwing stuff against the wall from either things I had read or thought, or of course, the other thing is, when you get to that point and that switch turns on, there's no shortage of people with advice, and it actually just makes it
True.
more complicated. And none of those people have an MD next to their name.
Right. No, you're right. There can be a lot of things that you get inundated with, and it's hard to sort through the information, what's factual, what's not, and what's evidence based. And there's a lot of things out there that are downright dangerous. So, what is something that you would want to share, kind of as last words for our discussion today, for somebody who might be considering that they need to lose weight, or they're kind of struggling with that component of how to get their mind set around? It can be very overwhelming, right?
Yeah.
So what is some advice that you'd like to share with them?
Well, I think that anybody looking at this and hearing us right now is probably 51% there, because there's something there that's acknowledging that, I need help, and I'm reaching out, and thankfully they're tuning into you and learning from you, whether it's a recipe and that's what they're following, or they're starting to understand the value of what you're doing. So I think they're 51% there. To get them the next 49%, I'm telling you, whoever it is, that one person or more I'm reaching,
Mhm.
is really think about your health, what you want your life to be like, and, you know, Father Time is undefeated, right? So all you can do is make the rest of the time we have on this earth as good as possible. And there's no shame and there's nothing wrong with getting as much help as you can, from whoever you can, especially if it's a doctor. So going to Dr. Mittal once a month and sitting down with a checkpoint makes me accountable. Both in what we're talking about to the actual numbers that don't lie from the labs and everything that we're doing. So I would just tell you, push yourself past that interest point that you have that tunes you into, that have you tuning in today, and really realize, okay, you're already kind of there in your mindset, but you're probably not taking that next step because you don't really know what to do. And that's okay, but you're in the right world now to take that step and ask that question. I'm terrified. What can I do? Well, Dr. Mittal can help you, and she'll be honest with you. Whether it's her or she needs other people to help, you're in great hands versus somebody who's trying to sell you a 16-week workout course or a DVD set or whatever it is, or a gym membership or a subscription plan for their food. That's a component, but you need somebody like Dr. Mittal to tell you how those pieces all fit together and kind of, basically orchestrate a plan for you personally.
Great. Well, thank you. Thank you so much, Matt. I really appreciate you sharing your very personal story. And I will be doing a Facebook Live for Wednesday after this video is put on the website, or I'm sorry, on the Facebook page. And then what we'll do is Matt and I will both be available to answer any questions or comments that you might have, so that we can provide that more personalized help that you might be looking for. So thank you, Matt, so much, and please stay safe in these crazy times.
Yeah, absolutely. Thank you very much for everything. We'll talk to you on Wednesday.
Okay, bye-bye.
All right, bye-bye.